nice to see you all who've made it, and delighted to have Siobhan O'Donovan with us, who is known now as the Booby Physio. So I think her knowledge is huge, so she's got a lot to get through, so I'm not going to spend ages introducing her, but basically she's talking about things that I'm sure us as predominantly MSK or just clinicians in general will have acknowledged but not really known what to do about it. So I'm just delighted to hand over straight over to Siobhan to enlighten us in all ways.
Thank you, Katie. Thank you. And yes, the puns are endless in this. It's a great. I love wordplay, and this is a great niche field to be in from that perspective. So thank you for having me. So just a little brief introduction to me, because I need to try and keep everything brief to get through what I've got. So I'm a chartered physio. I founded Posture Fitting basically because I suppose I connected the alignment and postural issues that I was seeing my patients having with potentially their breast weight. And as you'll see, we're not necessarily only talking about larger breasted women and girls. And I think that's a really important thing to get from this. So if you get nothing else from the next hour, please know that these issues do not only affect the larger breasted. They may affect the larger breasted with greater, I suppose, intensity or with greater impact, but they are still affecting everybody regardless of breast weight size, whether people know it or not, or whether they are suffering as a result of that or not. These issues are still impacting. So bit of background on me. I started my life as a PE teacher because my focus in my professional journey was that I wanted to be working in an active profession, and it was hundreds of years ago, and there was very little on offer, to be honest. So PE teaching was what kind of appealed to me the most. And then in my, I guess, third and fourth year of our training there, we were introduced to exercise physiology and sports injuries, and that really got me kind of going, ooh. And particularly when, after I did teach in London for, I did a year. It sounds like penance, but it wasn't. It was great. And one of my colleagues came back from a course that she had been on, and she said, all of the exercises that we do in our warm-ups are contraindicated. And we were all, what is this word contraindicated? This is a new word. And it was a new word because sports science was a new thing and had started to, become, I guess, more analytical in terms of movement. So that was a real eye-opener for me. And I was kind of like, oh, gosh, could I be teaching kids? And I apologize to anybody who's now an adult in London that I may have done this to. Could I be teaching them exercises that may actually not be the best option for them? And obviously we've kind of come full circle on some of that now as well, in the sense of movement being good. But just made me think, and then I wanted to study a little bit more. So off I went to the States, where I did a master's, became a professional over there, which is known as athletic training. So if you've ever seen, well, of course you've seen Wimbledon, they call for the trainer at Wimbledon, and that's the American sports professional qualification. So I did that while I was there, and also did my strength and conditioning specialism. That was when I came back. So I found myself talking more and more to my own patients about their posture, their alignment, what they were doing in their normal day, if they were coming in with a sports injury or if they were coming in with back pain or neck pain, whatever it was. We were having these conversations about, okay, let's see what happens in your life, and let's see if there's anything that is going on in your life that could be either predisposing you to this or might affect your recovery. And one of the things that over time, as I say, I was talking to people about these issues, and this concept that we as women are going to get smaller as we get older is something that has, I suppose, pervaded a lot of what I'm talking about now, in that this is considered to be inevitable and it's considered to be normal. And I don't understand why we consider it to be acceptable. And one of the things that when I started to research a little bit more into, I suppose I'm giving away the punchline now, but when I started to research a little bit more into breast weight, I did begin to realize that these images are almost always of women, that there are very few images of men getting smaller as they get older. Now, I am not for a minute about to try and dispel the physiological changes that happen in the vertebral column. However, there are certainly more factors at play for women than there are for men. And this is just, you know, an example of what modern life has us doing now, which is bringing us into this more flexed position. And it is simply harder for women and girls to come out of that flexed position. Whether that is something they you know, want to do for long periods of time or short periods of time is another story. But there's absolutely, definitely two elephants in the room when we are talking about female alignment and female resistance to gravity. So that awareness for me of breast weight having an effect on my ability to withstand gravity was an absolute eye-opener for me, and that's what started me on this road. So what we're going to look at today, and I apologize in advance because I'm going to have to shoot through this because it is a whistle stop tour, and it's a whistle stop tour that I keep extending. So I will try and move through it quite quickly. But we're going to talk about basically the biopsychosocial effects. So how breast weight can make us feel, how it makes us look, and that is important for patients. That wasn't something that, when I began this journey, that wasn't something I was factoring in, but it is something that patients repeatedly say. And how they look affects how they feel. How we look affects how we feel. So that is something that, you know, I have embraced because it's relatable to patients. And I think that's really important that we listen to them and hear what they're saying. Also looking at the effects of how we move and what we do, and also what we don't do. So breaking that down a little bit more again, how we feel and how we look can be broken down into the physical side of things and into the psychological side of things. And then how we move and what we do could basically be broken down into participation and performance. And then if we look at the indirect and direct impact on the physical and the psychological side of it, so the direct impact of unsupported or poorly supported breast weight is probably more accurate, is potentially breast pain, musculoskeletal issues, indirectly impacts on the respiratory system in terms of breathing and on the pelvic floor. And then psychologically, the direct impact being on self-image, on self-confidence, on self-esteem, and the indirect impact being on people's willingness to participate in life. And I mentioned earlier that I like wordplay, and there's you'll see my next couple of slides. There's a lot of P's in my life, and there's a lot of B's in my life now. And one of the B's that I have kind of talked about to people is being. It's about being active. It's about being present. It's simply about being. And breast weight affects absolutely what women and girls are willing to do and are willing and are not willing to do. So it does affect how they live and the quality of their lives. From a participation perspective, we'll look a little bit more at this. We'll look at puberty and teenage activity levels, and also activity, you know, the fact that breasts are a barrier to activity at other stages of life, and also because breast weight changes over our lifespan. So with it changing, that can make us again more predisposed to not doing things as a result of changes. And from a performance perspective, we know that there are physical enhancements that can be brought with positive breast support, and that comes down to some injury prevention stuff as well. So from that biopsychosocial impact, here's all my P words. So we breast weight can, through the vehicle of posture, affect pain, pelvic health, prevention of injury, perception of self, performance, participation. And again, that's some of the things we're going to chat through. I'm very mindful that there is controversy around the whole field of posture. I am absolutely going to put my head above the parapet and go and say that I believe it's really important, and I believe it's something that we should be talking to our patients about. When we look at the academic evidence, there is conflicting evidence on the association between pain and posture, and it is conflicting. It's not all saying that there is no link between posture and pain. And again, I'm biased, so I'm going to say this in that what I also think is really important when we look at that evidence is that we acknowledge that pain is multivariate and people are multivariate. So to be able to just say somebody's pain is caused by their posture or somebody's posture is caused by their pain is way too simplistic and not really applicable to real life. But I think what's more significant, not necessarily more important, because obviously pain is important, but what's more significant is the impact that we know posture has on function. So we know it affects lung capacity, expiratory flow. I'm going to show you some research on that. We know kyphosis in older persons is associated with shortness of breath and lung dysfunction, and that's potentially also related to their position. As they are more kyphotic, are women more likely to be more kyphotic than men? 100%. The middle section there talks about the effect of posture and mood, and we know we've had lots of research for a long time about the effect of posture on mood, and how basically a more positive posture, if you like, lots of words used that sometimes the language is a bit, you know, you'd be, I suppose, a bit mindful of using some of the words that are used in the older research. But basically, if we're talking about a more positive posture being a more thoracically extended position, that has shown to be more the case with that more positive outlook, and the reverse also being the case, more slouched, more negative access to memories and so on. And also we have evidence about postural changes being associated with both pelvic floor dysfunctions and pelvic floor muscle contractility. So I now have a picture of a Jack Russell on the screen, and the Jack Russell is there just to make you go, what on earth has a Jack Russell got to do with breast weight or anything that she's talking about? So I'm going to leave you with that thought for a while we look at breast anatomy. So if this was something that I didn't learn in any of my undergraduate work or my postgraduate work, which is why I'm now offering it as an educational resource for people. But the breast is comprised of 3 tissue types. You've got connective tissue, which is the Cooper's ligaments, which you may have heard of, and that's a misnomer. And also what they are presumed to do is also very widely misconstrued and misconceived. You've got your mammary tissue, and then you've got adipose tissue or fat tissue. And actually the fat tissue is for most women is the biggest bulk of breast composition, and that has an effect on whether they lose weight or gain weight. They may lose weight or they may gain weight on their breasts. They may not. It's different adipose tissue to the rest of the body. From that perspective, I just mentioned a little earlier that this weekend I was the scuba booby physio, and I gave a talk on boobs and buoyancy, and the fact that there's more fat tissue in breast weight does actually make women more buoyant from that perspective. So as a diver, you then have to compensate for that tendency to be buoyant. So it might be beneficial as a swimmer, but it certainly doesn't always act as a benefit for a diver when you're trying to get down into the water and control your buoyancy. The breast lies from the 1st to the 6th rib approximately in people, and this is the bit that I want to really reinforce here. Is the position of it. 2/3 of the breast base lies on pec major, and 1/3 of it lies on serratus anterior and external oblique. And the reason why I've highlighted the word on is because it lies on those muscles. So those muscles have no direct attachments to the breast, and therefore there is no breast support coming from any of those anterior muscles or anterior lateral muscles. So here's where Jack Russell comes in. So when we're talking about breast weight, there's a lot of breasts and bras are actually not as linked as you would think they might be in terms of the fields. So what we have is the plastic surgery field and reconstructive field within oncology, where surgical reconstructions may be done, reductions may be done, augmentations may be done, and what they talk about when they are doing those in the surgical side of things is they talk about how much weight they are going to remove from a breast or add to a breast or replace a breast with. Whereas the bra side of things doesn't relate to the breast weight, which is, I think, a real error and something that then causes a lot of confusion. So somebody who is wearing a 36E bra, and the reason why I put that one up is because I like to relate things to myself, and I'm a 32F, which is close to that there, and I would not be considered to be larger breasted in the big scheme of looking at breasts. But actually in classification, I am just on the edge of large and hypertrophic. Now, I'm not huge. I'm just going to bring my screen down and just show you I'm not significantly big. And my breasts have never been a barrier to me in exercise. And they've never been anything that I have thought twice about until I started here. Now I think constantly about them. But my point here is my breasts weigh around about 2 kilograms. So just short of that. So I'm carrying 2 kilograms around all day. That's the equivalent of me strapping Jack Russell to my chest. Now, there are other sizes of bras that would equate to that. So for women who are smaller backs than me, and for women who are larger backs than me. So a woman wearing a 42C or a 40D, or a woman in a 28GG, 30G, they would be carrying the same amount of weight as me. So I've put up a few other bra sizes here just with that weight equivalent and the animal, because that's a really useful thing to know. There's a squirrel. And then a duck. I was kind of surprised that a duck would be heavier than a Jack Russell, but I guess we're talking about fairly dense ducks here. And again, what those breast sizes equate to is actually quite eye-opening. What I'm going to share my frustration with breast surgery community, which is that when somebody does have a reconstruction or an augmentation, they are very often told, I'll make you a C cup or I'll make you an F cup. And that makes no sense, because as you can see from those letters and numbers there, which I don't expect you to understand, that's why you come on my course. The numbers and the letters are intricately, is that a word, are absolutely linked. So the breast weight of a 32D person is different to the 32FF, which is different to the 32K. So you cannot simply say to somebody, this is your breast size that I'm going to make you. So I wish they'd stick with the weights, which is what they should do. So if we look at how breasts affect activity, so this was a study done in 2015 in Portsmouth, and the University of Portsmouth has a unit there called the Breast Health Research Group in breast health. I always get that wrong. And they're very prolific now. They started their lives back in about 2000 and I'm going to say 7. And I remember Joanna Wakefield-Sker, who is the head of it, saying that the first few papers that she submitted to journals, they were all refused because the topic wasn't interesting enough. And I know it's ridiculous. It's absolutely crazy. And once she had her first, I guess, acceptance, there was now this realization that actually there is a lot that breast weight does to women. So it is something that's kind of important. So they've done a lot of work on the biomechanics of breasts and how that can affect women. So this and women and girls. So this was 2015. Like I say, they surveyed, and I'm going to say women around Portsmouth have obviously had a lot of input on their breast weight. So they surveyed these women and found that 33% of women were not meeting the physical activity guidelines recommended at the time. Now, this was the first study that included breasts as a potential barrier to activity. So generally, barriers would be the likes of health, cost, facilities, time. And this was the first time the breasts were ever added as a tick box, and they came fourth in the highest in the reasons for not exercising, came before cost and before facilities. So it's a significant barrier to women, and nearly 1 in 5 said that their breasts were an actual barrier to activity, partly because of difficulty finding a sports bra, and that's not something that should be the case anymore. And it's wonderful that there is a conversation happening now about sports bras. The problem that I have, and it's not about me, but the bigger problem here is the narrative is about sports bras. It needs to be about optimally fitting sports bras. There is no point in you having a sports bra that doesn't fit, that restricts your respiratory mechanics, that gives you no support and creates the same issues. And if you look at the picture in the background here, this is my favorite picture of all time, because what you've got here is you've 3 women running, but we're going to focus on the lady in the dark purple and the lady in the pink. And what you've got is 2 totally different running styles going on here. So the lady at the back, who is smiling, bless her, and she is out there running, holding her breasts in with her elbows, so therefore not running in an efficient style at all. Right now she's smiling and she's enjoying herself, hopefully, but that is the woman that will stop running. And the one in pink at the front, who is better supported, who's got that thoracic movement relative to her pelvis, that is the person who's more likely to keep going. And it is as simple as us getting women to understand what an optimally fitting sports bra can do for them or will do for them, and helping them to be able to do that independently. And not only relying on sports bras, but we'll stay with sports just for the time being. This study showed that there was no differences in level of breast pain or exercise participation between large and smaller breasted women. And I'll make the most of every opportunity to remind you of that, because it is not just a larger breasted problem. We know from the research Portsmouth have done that breasts move in 3 planes. So they move vertically, they move in an anterior posterior direction, and they move mediolaterally. And when we're walking, it's about 33% in each plane. But when we run, that proportion changes to just over half in the vertical plane, 27% in the AP plane, and 22% mediolaterally. Now that changes again when you're in water, when you're swimming, and obviously, you know, when you're jumping, that vertical component is likely to increase. Most sports bras in the current, and it's a minefield because there's so many of them out there that claim to be high support and actually are not. A lot of them have looked at the concept of compressing the breasts to try and stop that movement. But if we look at that, that's 20% of breast movement, 27%, sorry, of breast movement. So compression on its own is going to decrease all of those planes of movement, but it is focusing more on AP, which is only one of those 3 planes. So we know also that there are 10,000 breast bounces in 60 minutes of running at a 10-minute mile. And that's where the stats of that come from Portsmouth, as also did the 11,000 breast bounces in a football match. So that's a lot of actual physical amount of movement occurring to breast tissue. And if it's poorly controlled, then that has impact on the surrounding tissue in terms of how we compensate. So like this lady is doing, sticking her elbows into her side, therefore overloading her upper traps and levator scapula and creating a definite pelvic floor dysfunction because she's not getting that thoracic mobility for her shock absorption. Again, Portsmouth research, and also there's a unit in Australia that's called the Breast Research Australia unit, very clever name, and that's also really good and productive. They have a physio at their helm, which is great. That's Deirdre McGee, Professor Deirdre McGee. She definitely sees the clinical application of things as well, which is great. So up to 19 centimeters has been recorded in terms of vertical movement, and an acceleration level that is greater than what Formula One drivers actually experience. Now, when you stop and think about those kind of things, it's just crazy that the research has taken so long to happen. But look, it's happening now, which is great. But again, this is a really, really important health consideration, because the understanding is that acceleration is probably what causes breast pain, and it's actually it's more deceleration, because as the breasts move slightly slower than the body. So as the body lands, the breast lands a little bit later, and that slap is what is considered to be causing a lot of exercise-induced breast pain, as opposed to the actual displacement. But if we're coming back to thinking about the forces involved, I mentioned I'm carrying around 2 kilograms of weight around my neck all day. Now, because they grow with us, we don't necessarily appreciate that that's the amount of weight. But I mentioned this I've mentioned this in other situations. There is a video on YouTube, which I keep meaning to look up again, and it's 2 guys who take a couple of weights and put them around their neck, and they wake up in the morning with those weights around their neck, and they go through the day. And it's humorous, you know, but it's got a lot of really, really significant messages, and they were goosed by the end of the day. They went to the gym, they went to work, they went shopping. They absolutely acknowledged that breast weight is a considerable load for women to bear. And again, that's regardless of size. So what we're doing constantly is we are resisting gravity. We don't know that we're doing, or we're not resisting gravity, as the case may be. So if I'm running, my breast weight is going to be 16 kilograms worth of load on the front of my chest. Now, that's the Jack Russell plus the squirrel plus the duck plus all the other animals, to be fair. This was a study that they did in Portsmouth that looked at the physical activity participation of girls. And this is a real, like, having started my life as a PE teacher, this is really important for me, because I think we have a role as healthcare professionals to be able to influence people's physical activity levels from the get-go, and as teachers also, and as parents, and as mothers, and and as sisters, and as friends, and as colleagues, and as fathers. It doesn't necessarily have to be the responsibility of females, but we know that girls drop out of activity at a much higher rate than boys. We know that there are reasons for that they've identified. Some of it is periods, but some of it is breast weight. So this study that Portsmouth did in 2016, they looked at over 2,000 schoolgirls in the London area, and 46% of them said at that stage already, between the ages of 11 and 18, their breasts had some effect on their participation in compulsory sports, by which they were saying they would, find a reason not to do it. Nearly 3/4 of these 2,000 girls, you're talking 1,500 girls here, had at least one, if not more than one, breast-specific concern already. And 38% of that was breast bounce. Now, that is so influenceable from the point of view of educating them in how to manage their breast weight. And what was really nice to see was that 87% of them wanted to know more. So they have an appetite for learning about this. They are ready to hear how to support themselves better. Here's Pamela Sue, who will keep running unless I stop her. Oh gosh, and when I'm on here, I can't stop her. So she's just going to keep running, sorry. So this is the iconic image of Pamela Sue Anderson going down the beach there in Malibu, whatever she was off to rescue somebody. And that's iconic for lots of reasons. But what I want to show here is actually how unrepresentative that is of most women, because Pamela Sue has implants. So she's got breast support there that is not, well, it's creating weight. So she's still going to end up with breast sag at the end of it. But the actual reality of the way breasts move is different when you don't have implants. And these next pictures that I'm showing are one of my partners, a posture fitting partner, and she's given me permission to use these. These are videos, and I want to show you the difference here between different sports bras. So the picture on the where she's wearing the kind of peach colored top, that's her in a compression sports bra, which is really a crop top. There's probably minimal compression even in that, so you know what you're expecting to see here. The second one is an encapsulation style bra. With encapsulation, they have separated the two breasts into two different cups, and if you have one moving force, that is a greater mass than two smaller moving forces, so that's going to be less of a mass. So that's the idea with the encapsulation. And then what we also have is a hybrid style, which is a combination of both, which is the better sport bras tend to be a combination of both. So if I show you what happens, you'll see the breast slap here. So that's that is just jumping up and down on the spot. And if you also watch her chain and her hair, you can see the vertical component there in terms of that movement that she's getting. So if we go to the encapsulation one, I can't get at it because the video is on the other one. There we go. So you can see that movement is a little bit more controlled, but you can still clearly see that slap. I mean, that is the best way to describe it, that both breasts, they're now going south and southwest instead of going straight south. And they are both still moving a huge amount in that bra. And then in her optimally fitted hybrid, so it's not just a hybrid good sports bra, it's optimally fitted, that amount of movement is decreased, but also you can see she's jumping higher. So her performance has improved. So if I can get them all going together. Sometimes they coordinate and you can see the change. So an optimally, yeah, I know it's painful, I'm going to stop. An optimally fitting sports bra is a really, really important item of equipment. It is a piece of sports kit. We need to stop looking at it as a piece of clothing. We need to look at it as the same as your trainers or the same as your shin guards. Pamela Sue, unfortunately, is just going to keep going down the beach there. So we're going to talk about this pull-up banner thingy that was once noted in a lingerie shop. The average female runner's breast travel a staggering 3.77 miles in bounce when running the marathon. I am this sad that I looked at that and I went, really? And I did the maths, and it's true. So you can save 12 minutes on a marathon time in terms of the amount of breast movement that happens. You can save 12 minutes when you're running the marathon by being in a better supported bra. So just a little run through here of some of the performance side of things. With poor breast support, there's an increased ground reaction force that has consequences for the pelvic floor as well as for performance. Decreased breathing frequency, could say the same thing again. Decreased stride length, 4 centimeters decreased stride length with poorly supported breasts. 4 centimeters is a significant amount of distance over any distance. So that can make a difference. Now, one of the things I suppose that's frustrating isn't the word, but the way it is at the moment is that a lot of the research has been done on running and on treadmill running. So some of it is, you know, obviously we will apply that in the field, but there is definitely a need for more research to be done on more activities. Decreased economical upper body profile, which you saw in the images of the two women running earlier. Increased perceived exertion was one of the things that was reported in one of the studies, and increased upper body muscular activity as shown on EEG. So if we look at the psychological side of things, this is 3 different studies that I've just put up here, all done by plastic surgeons, because the outcome measures for somebody having had a breast reduction is where we see the differences in how somebody feels pre and post reduction. So we know that one of the reasons for people seeking breast reduction, whether that be on the NHS or whether that is privately, is because of psychological issues. It is because of lack of self-confidence. It's because of, you know, just their inability to live their lives, and they don't go and do things, and they will always be the person who goes to the back when photographs are being taken, or who isn't there at all because they didn't want to go out and be seen. So we know there's a significant psychological load that breast weight management can positively impact on. And currently, the only thing that's on offer for people is breast reduction surgery. And I absolutely want to change that. And I think we're in a really, really good position to be able to change that. But these 3 studies all show, as you would expect, that larger breasted women who had surgery all had improvements in their self-esteem, in their lowered levels of anxiety and depression. So breast pain itself, cyclic and non-cyclic breast pain affects up to 70% of women. And there's a I don't want to say fallacy, but you could think that breast pain is more exercise-induced, that's where it's coming from, particularly with the videos that I've just shown you. But exercise-induced breast pain is also very common. It happens in 44 to 72% of exercising females and 44% of female athletes. Now, I've put that up because female athletes are kind of considered to be either at the elite level or at the professional level. And at that level, they are still struggling with exercise-induced breast pain. Now, Portsmouth, who did the study that I'm going to show you next, which is on marathon runners, they looked at the 2012 London Marathon, and they surveyed, I'm going to say 1,825, I think is the number, something around that anyway, a lot of marathon runners. And the information that came up on breast pain there led them then to do a further study to see whether the issues that were reported were because of exercise. So let's have a look at those. So 32% of the women who who were surveyed, who were running in this 2012 London Marathon, 32%, nearly, that's a third, 1 in 3, including 24% of women with small breasts, they reported breast pain. And small breasts, they were categorizing as breast size that the person was wearing their bra in. Normally, Portsmouth would be really, really good about categorizing that by checking people and by fitting them. But obviously this was a survey, so this would have been based on bra size as to the categories of smaller or larger. 44% of them did nothing to overcome their pain. And this is something we're seeing. A lot of the research that's happening now in the last 2 years is on breast injuries in contact sport. You know, so particularly looking at the likes of rugby, Australian rules, and you know, you could take that onto courts and look at basketball and netball, where there would be a lot of elbows being poked into breasts. So a lot of those kind of contusion injuries that are occurring. Again, athletes are not reporting them to their physio or to their doctor because they don't think there's anything that can be done about them. 17% of the people who completed this London Marathon, right? So we all know about how much training goes into preparing for a marathon, but nearly 1 in 5 of them reported changing their exercise behavior due to breast pain. Continued running, but just maybe changed from doing perhaps higher impact stuff. And that's again a huge amount of people who are suffering unnecessarily. There was a high number of them that were wearing sports bras, so it was a higher number than the general population, but 75% of them reported that they were uncomfortable in their sports bra. So again, this is people who have trained for a marathon, so they're not just going out doing, you know, the odd 2K here and there. That's a lot of mileage, and a lot of discomfort and poor performance as a result. There's definitely stats about people finished in terms of their times and breast support. So looking at MSK pain, again, this is just a few studies that I've put up. I'm not going to go through them all in detail, other than I do want to talk about the last one. They're all indicating that there's a positive correlation between shoulder neck pain, upper back pain, upper back kyphosis, and larger breasts is what most of these studies are looking at. Again, I would be asking what they're quantifying as larger breasts, because I'm now considered larger breasts and I probably wouldn't have been included in these studies. This study at the bottom, Lauren Howarth is at the University of Central Lancashire in Preston. She did her PhD on breast support and low back pain. And what she found was significant reductions in reported thoracic pain, significantly reduced reported lumbosacral pain, and clinically important reductions in neck disability, back pain frequency, continuous pain. All of the things that we are trying to work with our patients on a day-to-day basis by intervening in their breast weight support. What she also found, which was incredibly startling, and this has been, she did, you know, with the PhD you do a few different studies, and she did 2 different studies, and in one of them she sent people out for professional bra fitting. 67% of them came back in an incorrectly fitting bra, having been professionally fitted. This is why I'm now doing it. And in this study, 90% of them came back still in incorrect fit. So the question that I get asked all the time is, what do I do about this? And this is why I started. I basically realized the connection, realized that my patients needed to be in better breast support. And I was thinking, okay, go out and get professionally fitted. And the same thing happened to me. They came back, they were in stuff that was still not right. So I went, you know what, if I can't rely on anybody else doing it, I'm going to learn how to do it, and I'm going to teach you how to do it yourself. So it's the whole fish parable. So talking about pregnancy and breastfeeding, this is a patient of mine who, she's kind of my poster girl in terms of, she's my before and after that I have on a lot of my my resources, and she's given me these pictures and given me permission to use all of them, obviously. This was her, the picture on the left, it was a week before she gave birth to her first child. The second picture is a week after she gave birth to her first child, and what you may not be aware of is that breasts keep growing. Obviously, they grow during pregnancy and they continue to grow postpartum for the first week. And then depending on breastfeeding, there will be changes to them as a result of that. This girl's name is Carol. She's very slim. She had, when I had my epiphany on kind of breast fit, bra fit and breast weight, that happened for me in London, and I sent her to London to be fitted, because I wasn't able to do it at the time. I wasn't in that space. I hadn't kind of learned enough. And she went over 36B, which of course she wasn't, like she's a size 8. But how many women are 36B, 34C? It's just crazy. That's because the shops sell those sizes, by the way. That's why we buy them, because they sell them. And why do they keep selling them? Because we keep buying them. And why do we keep buying them? Because they keep selling them. Loads of catch-22s here. So she went off to London, came back at 30 double G. Well, she didn't come back at 30 double G. She was always at 30 double G, but came back with the awareness that that was the size that she needed. And as she was gaining breast size in pregnancy, she really, really struggled to find anything that fit her. She did have PGP, and I have a huge theory about PGP and breast weight, and about how, you know, when we are looking at supporting women during pregnancy, we need to look at supporting breast weight better. And it is not true that pregnant women should not wear wired bras. It is about the wire being fitted correctly. So again, there's a lot of myths and a lot of old wives' tales, or whatever you want to call them. Once somebody knows how to fit themselves, they know how to ensure that the wire is giving them the support that they need when they're getting bigger, without impacting on breast tissue. So a week before she had her baby ended up being 8 pounds 4 ounces, or 3.75 kilograms. She weighed her breasts because she was just insane with how big they were and how much they were bothering her. And her breasts weighed 4 pounds on the kitchen scales. Now, kitchen scales, to be fair. So accuracy, you know, we're not going for n equals 1 here. But her baby effectively was the same weight as her breasts were. So try carrying that around with gravity pulling you forward and without the muscular ability to withstand it. Why are we not supporting women better in this phase? This is the week after he was born, and you can see his size relative to her breast size is pretty significant. She didn't breastfeed. She tried to breastfeed him. She had difficulty breastfeeding him. She is still guilty to this day about the fact that A, she didn't continue breastfeeding him, and B, with her second child, she didn't even try, because even though her breasts were not as big the second time around, she had so many traumatic memories of trying to breastfeed her first that she didn't. And she is still feels guilty to this day, which obviously we've talked about, you know, but that's a burden that she could be carrying for the rest of her life, all because of her breast weight and not having that support while she was breastfeeding. And also, you know, breast weight changes over breastfeeding, obviously, as the milk comes in and as the milk goes out. So again, women need to be aware of how to support their breasts when their breasts are at the point that they need the most support. So this is the pelvic health kind of slide that I've put together, which has way too much information in it, and I'm going to just go through it quite quickly, just to basically say that when we're looking at some of these postural anomalies, which is what they are, they can be affected by breast weight, and that can then have an effect on the pelvic floor musculature, which in turn affects breath, affects ground reaction force, affects leaking, affects prolapse. And this is Carol, happened to be wearing the same t-shirt as she had the week after she'd had her baby, which is very handy because you can see the difference in terms of just her positioning. And this is not just with breast support. This is with talking to her about the internal side of supporting her body better from an alignment perspective. And there is research showing more upright body positioning, allowing for more diaphragmatic breathing. And, you know, you don't need to be taught this. It's very obvious when you look at the abdominal cavity and when we look at the effect of the diaphragm with the pelvic floor. We know they are, again, intricately connected. And also learning slower breathing and heart rate variability is easier to do when you are in a more upright position. That erect word is the word that they've used in that study. But again, you know, there are so many benefits to the pelvic floor from the perspective of it functioning better if we have breast weight better supported internally and externally. This is a study just showing after breast reduction how many women had improvements in their pulmonary function tests. So out of 19 women, 17 of them had improvements in pulmonary function tests. I will get, when I'm talking to patients, whether it's as a group or very often when I do these kind of talks, I get people to sit out at the edge of their chair and go into a more flexed position, take a deep breath in, let it out, and do the same in a more extended position, because it seems like it's very obvious, but it isn't as obvious to people. as we may think it should be, that you can breathe better if you are in a more extended position. If you spend all of your day in a more flexed position, then you're going to be doing upper chest breathing. You're not getting that diaphragmatic breath in. You're not getting that improvement or that connection with your pelvic floor. And, just again to show the biopsychosocial side of this, all of the women in this study felt they had an increased confidence as a result of having a reduction. And look, they had 1.5 kilograms on average taken out. So that's a reasonable amount of breast weight. All of them ceased analgesia use, and 2/3 of them improved their exercise tolerance. Now, that may be related to the fact that 6 of them were smokers. I'm not sure, but certainly that improvement in pulmonary function is really important. So I'll also talk to people about orthotics and about the fact that if you're needing support under your feet, you're not just needing it when you're doing an activity. You're not just putting them on when you're going for a walk. And we need to look at the external support side, not just simply from a sports bra perspective, but look at it from a constant day perspective, when the person is, soon as you get up in the morning to when you go to bed at night, and possibly even for some people wearing bras sleep support during the night may be necessary. So this is a physio who came on my gals workshop, and I do something called a feel the fit, where people come in and they get to feel what their optimal support feels like, because most women, including physios, so far to date, I have 100% of people not in the right bra. 100%. Not the 70 to 80 that the research shows, not the 90 to 95 that bra fitters have told us. 100% so far for me and all of my posture fitting partners. So Charlotte came in, she was postpartum. You can see that kind of sway back position, postpartum position, where she's still leaning back, which is what women do to lift the bump and to lift the breast weight. So there's all those consequences on L5S1. And this was her in her before. That's the bra that she came in. Handily wore that shirt, which was useful. So there is recent evidence from Lauren, who's the girl that I mentioned in the 22 study, and a Portsmouth study done in 21, where they created a posture bra with a manufacturer. Now, I personally don't feel we should be medicalizing bras to that extent that people are talking, but they're out there on the market. And the idea with that was to look at enhancing thoracic extension, basically. And both those studies showed immediate changes in breast position on the trunk and showed immediate benefits to posture. Okay, so that's a good thing. So we know external support can improve the breast position on the trunk and can improve posture. So Charlotte got those benefits. But what we also know from those same studies is that it was not sustained. So if your breasts are being supported by an external piece of material, that material is still subject to gravitational forces if your body is not responding to that pull forward. So in both of those studies, when they came back, one of them was 4 weeks later, the other was 12 weeks later, the improvements had not been sustained. We know from what I mentioned about Lauren's study and then her follow-up one that professional bra fitting is not the answer, because that's unfair. Professional bra fitting will be very positive for some people. It's not positive for everybody. And a lot of people find it intimidating, and a lot of people have had poor experiences. But for me, the crux of it is it reliable? And can I send all of my patients, whether they are my virtual consult that I did last month in New York, or whether that is somebody local to me, can I send them to somebody that I can trust to optimally fit their bra? And because the answer to that was no, that's why I started to do it. And what we have created by looking at the internal side as well is therefore a more sustainable solution. And I'm going to explain that now. When we look at the internal support, which is what alignment is going to give us. So this is a patient pre-posture fitting. So you can see, if you look at where her breasts lie relative to the panel in the door behind her. And this was her after she had had some posture prompts, some very basic alignment cues, very basic. You can see her whole body has moved back, so she's closer to that light switch than she was. So she was in a bit of a sway back. She's now got her pelvis more kind of on top of her ankles, and she's got her ribs on top of her pelvis. So she's in that more stacked position. But look at the effect that's had on her breast position. So her breasts are now pointing in a different direction. It changes the breast orientation relative to the floor, but it doesn't change the breast position on the trunk. So her breasts look like they're in dipped headlights in the first picture, and in the second picture, she's at full beam. But she's at full beam, her breasts are now pointing forward because she has extended her thoracic spine and her lumbar spine to some extent. So her erector spinae are doing that work. And this is a patient of mine in a bra that I had fit her in, and this is her when she added in a couple of postural cues. So you can see the difference there in terms of the breast position. It looks like her breasts have gone up on her chest wall, but they haven't. What she's done is she's moved her body relative to the floor. So why don't we combine both? Why don't we get the external and add the internal? Why don't we do the internal and add the external? And if you look at both of those, you can see dipped headlights, full beam, high beam, dipped headlights, full beam, high beam. And that is as a result of combining the internal and the external. And what we also get then is a proprioceptive benefit, because the bras that I talk to people about using have a racer back. So I don't know whether you can see that on me there, but mine is coming across here. So it's giving me that same proprioceptive input as the tape that I used to do back in the day. Thankfully, I don't have to do the tape anymore now because the bra does the job. And this is just showing the levels of impact that their breasts have had on their body for people who have looked for breast reduction. We know all of these things happen with women who are poorly supported. So there's definitely an opportunity there for us to change that without going into a surgical situation. So hopefully you'll see that what I've talked about has indicated all of these different things are all connected, that what we do affects how we feel affects how we look, that affects what we don't do, and that affects how we move, which affects what we do. They're all interlinked. With posture fitting, here's my little sales pitch. With posture fitting, what I've created is the kind of thing like the Cirque du Soleil. It's not gymnastics, it's not theatre, it's not music, it's everything together combined into a different product. And posture fitting allows us, as a result of being a combination of the lingerie and the posture and the physiotherapy kind of fields, it allows us to access areas that generally are not open to physiotherapy, not open to healthcare practices. So we can access the sports and the fitness fields from a preventive perspective. Yes, that's an area we could always access, but we know, sometimes prevention is harder to sell, isn't it? And certainly we can access fashion and well-being. I did an Instagram live with a fashion house based in London, and within half an hour they'd had 40,000 views. I could be doing social media stuff forever as a physio to get those many views. I'd have to go on TikTok, which I'm, So it is a great PR story. And I have to say, moving from my branding of posture fitting, I haven't moved from it, but adding the branding of the Booby Physio or Booby Physiotherapy has massively increased my reach, because women find it relatable and the likes of journalists and are interested in it. I was on the national radio station here last year. I'm still dealing with the inquiries. That was a year ago. So breasts do mean business, and I'm not going to apologize for showing you the benefits to your business here, because you have a lot of females in your private practice, and most of them, 85 to 100%, are in poor breast support. A lot of them will have high instances of neck and back pain, and we have research telling us that more women have back and neck pain than men. But has anybody looked at that in the conclusions in the research? No, never mentioned, never mentioned. It's an opportunity for you to reach markets that are both in your current patients, looking after them, giving them an added value to their treatment, and accessing your past patients, certainly accessing potential patients that they don't know they need you yet. And it's definitely a USP which can, differentiate your practice from others. So my take-home message to you is, I need more physios to be offering this service to women, because what's happened for me is people have said, oh, this is great, like, I'm delighted, I've told my sister, I've told my cousin, I've told my aunt, and they're all over the world. And I therefore need people all over the world, which is why I'm now teaching my Gals Against Gravity workshop. And then there's a level, that's the introductory workshop. And then there's a level of, next level of training, which is to go on and offer the service. So this is the kind of thing you can do for your patients. You can educate them about their posture alignment, about breasts, about bras, and about bra fitting. The point for me is to make patients independent in this situation. So we empower them, we educate them, and we do enlighten them. And this is Carol, after her first baby, going to a wedding that she did not want to go to. She was adamant she did not want to go, but she went. And this is her after her posture fitting. So we can make that level of a difference. And I would love to have you help me do that.